Happy holidays, everyone. My name is Ryan Quist. I'm the Behavioral Health Director for Sacramento County. And here, as we're coming to the end of 2021, I thought it was important for us to take a moment and reflect on everything that we've been through and continue to work on. We have to acknowledge that over the last 2 years, we've been through a lot. We have COVID, we have a pandemic, we have a lot of discussion around the disparities that are seen within our society, within our institutions. We've seen heightened need for behavioral health services. We see a lot new barriers to care. Our homeless population is continuing to have a lot of challenges. We also have a lot of anxiety that's been in the community around our political landscape, everything from our elections to the post-election sort of conversations that we continue to have within the community. We have environmental and climate anxiety in the context of fires and all the things that these changes are bringing to our communities. And then last thing I'll underscore is that before COVID, we had a workforce shortage. And now here at the end, I hope the end of COVID, we see that we now have a workforce crisis. We're having the most difficult time finding folks to do this important, difficult work. And in spite of all this, you all continue to do such an amazing work. I'm so lucky to be working with you all. I feel so fortunate that you all are so dedicated to this important work. So thank you so much for what you do. You are behavioral health champions. We have a lot of new stuff coming in 2022. So just looking forward, we have a lot of new exciting initiatives from our wellness crisis response that the community would like us to build up as an alternative to law enforcement response to behavioral health crises. We have assisted outpatient treatment. We have some MHSA expansion. We have a lot going on. I'm sure I'm forgetting something, but a lot of exciting work for all of us to put our heads together and figure out how we can do this the best for our community. One of the things I'd like to pause and just do a quick shout out to our treatment center team. Throughout the pandemic, they have continued to do the work in person and continued to serve our community. It takes a lot to run a 24/7 facility, and there's a lot of challenges, and it's been very difficult with all the changing instructions from the state around how to safeguard against COVID, and you've all rolled with the punches and continue to be flexible and resilient in how you come to work and make things work. In addition, all of our county operated programs that continue to do things in person and continue to serve the public. I know I can't list them all off the top of my head, but our APS clinic, our CAPS clinic, we have our mobile crisis support teams, community support teams. We have our child welfare CPS team and I'm sure youth detention facility. I'm sure I'm forgetting somebody, and I apologize, but all of you who continue to do this important work in person and serve the public, we thank you so much. You're champions. And then now I want to turn to those who have been able to transition their work towards telework. This has been a learning experience for all of us to figure out how we can continue to be productive, stay in touch with each other as we move towards a telework sort of an environment. And for 2022, we plan on continuing to do the telework when it's possible. However, we are going to need to have some conversations around what does office space look like going forward into the future if most folks are doing telework in certain offices. So please stay tuned for those conversations. We will probably need to move away from the idea about dedicated office space for each individual. So I might not have my own office anymore. If I'm going to be teleworking, I might need to share, or but we need to figure out what that's going to look like. And so please stay tuned for those conversations. Another exciting initiative that's coming is CalAIM, California Advancing and Innovating Medi-Cal. These are some exciting initiatives that have some very specific components focused on behavioral health, including payment reform and documentation redesign. These are going to impact the way that we do things. And everything from contracting to our cost reporting to our documentation of services is going to change. And it is intended to make things easier and better. We've been very involved at the state level in advocating for what that should look like. But it's going to now take some adjustment and some creative thinking to figure out how to implement this in the best way here in Sacramento County. So we're gonna all have to put our heads together and make sure that we're thinking about what does this look like going forward. The last topic I wanted to mention is that we need to continue to have focus on cultural responsivity. Sacramento County is a very diverse community with a number of threshold languages. We need to continue to work towards developing our services and our programs in a way that will be responsive to the diverse community. I want us all to come together and have conversations about that. I want us to continue to make that a focus of our conversations so that we can continue to be as responsive to our community as possible. Finally, I just want to stop and say thank you. You all are amazing. Really appreciate all of the work that you continue to do. I hope you enjoy the holidays, are able to spend some time with your loved ones, and then come back and we all get to start up a new 2022 with some new energy and to tackle these exciting new initiatives. So thank you so much for your time.